Welcome to Tina's Brain Turner. Today we're diving deep into the fascinating and often misunderstood overlap between ADHD and trauma. Understanding this link isn't just about better diagnosis. It's about better treatment, empowerment, and lasting change. Why ADHD and trauma are so easily confused. ADHD and trauma share strikingly similar symptoms, including impulsivity, hyperactivity, emotional dysregulation. But here's the twist. Trauma can mimic or even worsen ADHD symptoms. Research shows both conditions impact the same brain regions, making diagnosis tricky. Real-world impact. In my mental health career, I've worked with many individuals struggling with both ADHD and unresolved trauma, often rooted in childhood experiences. Some turn to substances like cannabis for relief, but this can backfire, increasing risks like psychosis and emotional instability. How childhood trauma rewires the brain. Amygdala, hippocampus, prefrontal cortex. Trauma doesn't just leave emotional scars, it physically alters brain development. Overactive amygdala, hypervigilance, emotional outbursts. Shrunken hippocampus, memory issues, confusion between past, present. Weakened prefrontal cortex, poor impulse control, emotional dysregulation. Sound familiar? These are also core ADHD symptoms, which is why misdiagnosis happens so often. Key takeaway: trauma-informed care isn't optional. It's essential to avoid mistaking trauma for ADHD, or vice versa. The body keeps score. Trauma's physical toll. Stress increases, putting more stress in the metaphoric stress bucket through rising cortisol levels. Chronic trauma doesn't just affect the mind. It wreaks havoc on the body. Disrupts the HPA axis, keeping stress hormones, like cortisol, elevated. Triggers inflammation, weakens immunity, raises risks for heart disease, autoimmune disorders, and more. The psychological fallout. Trauma's hidden links. Childhood trauma is tied to a range of conditions, including PTSD, depression and anxiety disorders, borderline personality disorder, BPD, dissociative identity disorder, DID, and these often coexist with ADHD, creating a complex web for treatment. The cannabis trap. Why self-medication fails. Relief, worsening symptoms. Many use cannabis to manage anxiety or inattention, but for trauma survivors, it can become a dangerous cycle. As one client shared, "The more I used, the more I needed to cope." Professional guidance is key, because what feels like relief today can deepen struggles tomorrow. Treatment showdown. What works? Comparison. CBT, medication, EMDR, mindfulness. Let's break down the options. CBT. Effective but tough during emotional overwhelm. Medication. Helps ADHD symptoms, but doesn't heal trauma. EMDR. Great for trauma, not designed for ADHD. Mindfulness. Helps both, but requires consistency. So what's missing? A holistic approach that bridges the gap. Solution-Focused Hypnotherapy, SFH. A game changer. As a specialist in SFH, I combine hypnosis, positive psychology, and solution-focused techniques to regulate emotions, reduce stress, rewire negative thought patterns, strengthen focus and attention, improve sleep and coping, harness neuroplasticity, the brain's power to heal. Unique SFH techniques. 1. Rewind. Safely reduces emotional charge from traumatic memories. 2. Reframe. Shifts perspective from problems to strengths and solutions. Note: these are only used once emotional arousal lowers. Think an emptier stress bucket. Why SFH stands out: relaxes the mind and body and provides a sense of achievement. SFH isn't just therapy, it's empowerment. It helps trauma survivors break free from the past. ADHD brains tame impulsivity and sharpen focus. While SFH doesn't treat ADHD's neurodevelopmental roots, It addresses the emotional and behavioral hurdles that hold people back. Final thoughts. Clarity leads to healing. ADHD and trauma overlap in ways that complicate diagnosis and treatment, but with the right approach, real progress is possible. Solution-Focused Hypnotherapy offers a compassionate, empowering path forward, especially when combined with other supports. Ready for change? Let's talk. Book your free consultation today. tinaducketsurwa@gmail.com. Wrexham Hypnotherapy, helping you move forward.